Right, kia ora koutou everybody. Yesterday I visited the Auckland quarantine facility at the Jet Park Hotel, and I also visited the Auckland International Airport, where there were disembarking passengers on a flight from Sydney who were being processed. At both of those sites, I saw teams of diligent, committed people following very strong and robust processes and taking all of the necessary precautions to keep themselves and others safe. I had the opportunity to discuss with them at length how our systems are working, and I was very pleased to be able to see that for myself during the visit. I want to reiterate here the Prime Minister's words from this morning that no system can be 100% perfect. However, constant vigilance have been and will continue to be our watchwords. I wanted to hand over to Dr Bloomfield, who will provide today's numbers and give more information on the new testing guidance that was issued yesterday, and then I'll pick up on a few other related matters. Dr Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So today there are 2 new cases of COVID-19 to report in managed isolation facilities. It's now been 75 days since the last case of COVID-19 was acquired locally from an unknown source. The first of today's cases is a man in his 60s who arrived in New Zealand on 10 July from Pakistan via Dubai. He is at the Sedima Hotel in Rotorua and tested positive at the day 3 routine testing during his time in managed isolation. The second case reported today is a woman in her 50s who arrived in New Zealand on 10 July from Dublin via Dubai. She's also staying at the Sedima Hotel in Rotorua and likewise tested positive on the day 3 testing during her stay there. So the total number of active cases in New Zealand presently is 27, and our total number of confirmed cases is now 1,197, and we will be updating the World Health Organization with that number. None of our current active cases is receiving hospital level care. And yesterday our laboratories completed 2,061 tests, and of those 902 were testing of people in managed isolation or quarantine at either the day 3 or around day 12 testing. Total number of tests completed to date is now 433,324. As the Minister said, yesterday we issued some updated guidance for clinicians around testing for COVID-19 in the community. The updated advice clarifies for health professionals which of the lower risk symptomatic people should be tested in the community. So this is testing of people with respiratory symptoms, all the people who are classified as being high index of suspicion, for example, because they work at the border or they live with someone who works at the border or live in a family where there's a member of international aircrew. All those people are already being tested. And this guidance clarifies the other groups of lower risk people in the community that should be offered swabbing. So that includes people who are at higher risk of complications should they get COVID-19, older people, people with pre-existing medical conditions, and also our Māori and Pacifica communities. And just to reiterate, note this is testing of people with respiratory symptoms. It's not asymptomatic testing. So, as has been emphasised over the last few days, it's very important New Zealanders are not complacent about the threat of COVID-19. We need to continue testing in the community as part of our efforts to detect any possible cases that may have slipped through the border. The updated advice also includes a reminder that just a throat swab is an acceptable test to be done in this group. People will be offered a nasopharyngeal swab. It can be quite unpleasant, and so it will be appropriate for a throat swab to also be used. The throat swab is slightly less sensitive because it needs you need to get more viral load on the throat swab to be able to return a positive test, but it's certainly a very acceptable test, and my hope is that with the offer of a throat swab, people will also accept that offer. So just a reminder, anyone with respiratory symptoms during this cough and cold season over winter, please do call Healthline or your GP to get advice about getting a test. And finally, just an update on the people whose tests results were delayed yesterday at the Novotel Ellerslie. Their day 12 testing results took slightly longer to come back than usual. All 12 negative tests had been returned by 6 o'clock last night, and 10 of the 12 people and others in their associated bubbles were then able to leave. 2 of the 12 stayed overnight and have left today. So it's important to note these tests were not mislaid or missing, but were in the system. They just took longer to get through the laboratory reporting process than expected. That was the case in 9 of them. And 3, the swabbing had been delayed for 3 people. It was undertaken, processed urgently, and the results back by 6 p.m. Thanks, Minister.
Thank you. I was very pleased to see the updated advice on testing going out, which will provide clarity for CBACs and for GPs on who to test. The updated advice also confirms that testing remains free and that testing in the community is an important part of our ongoing strategy to continue with the elimination of COVID-19. If people are offered a test, I strongly encourage them to take it. The updated advice also confirms that health professionals are funded to do COVID-19 swabs. Last week, or week before last actually, I visited a CBAC myself, and it was clear to me that the testing is a significant effort for our primary care workforce, and I do want to thank them for the very significant part that they are playing in ensuring that we've got a good level of testing as part of our response. This morning, the Prime Minister outlined the preparedness that we've put in place should there be a resurgence of COVID-19 in New Zealand, that is, should there be community transmission in New Zealand. We did this because we want the public and the business community to have as much certainty as possible around what would happen and how we would continue to use the alert level system in such a scenario. Our strategy continues to be elimination, and breaking the chain of transmission remains the foundation of our response no matter what. As the Prime Minister said, we do need to ensure that our border and our managed isolation facilities stay as tight as possible, and that our frontline workers at the border are using PPE and other protective measures, and that they are also being tested. I do know that New Zealanders will join me in showing our appreciation for each and every one of those people who are doing their bit to keep us safe, and we will do that by washing our hands, coughing or sneezing into our elbows, staying at home if we are unwell, and of course, keeping our digital diaries. So on that, I wanted to pick up on a few points from this morning around contact tracing. There were a number of questions, so I wanted to run through what steps occur with contact tracing if there was a community outbreak. Contact tracing is a core public health response, and the basis of it is anchored in our public health units, contact tracing teams firstly undertaking interviews with cases to get a full understanding of their contacts. Based on the recommendations from the Verrill report, public health units have been working on capacity uplift to support a potential rise in COVID-19 cases, and the national contact tracing solution is now in use by 11 of our 12 public health units, and the 12th will be coming on board by the end of the month. Nationally, we know that public health units can investigate over 300 cases a day now, with extra surge capacity available should it be required. The Ministry is working to build additional capacity in this area by training its own staff to do case investigation as well. The National Close Contact Service can currently make up to 10,000 outbound calls a day for contact tracing, and by the end of August, I've been advised that that will be doubled to 20,000 using surge capacity. A test of the contact tracing extended system is being planned with one public health unit by the beginning of August, and planning for similar testing with other public health units is also preparing to get underway. Finally, a few words on the Contact Tracer app. There were a number of questions about that this morning. I want to reiterate that the app is one part of a whole system of contact tracing that's being used, and it relies on every one of us doing our bit to ensure that it is effective. Even by downloading and registering with the app, you provide the Ministry of Health with your most up-to-date contact details, which is extremely useful if they need to get in touch with you as a result of contact tracing for another case. So thank you to the 596,000 New Zealanders who have taken that step so far to date. If you're watching this and you are not part of that group, I encourage you to do it today. Also, remember that any information you give to the Ministry of Health is only held by them and only used for the purposes of contact tracing. So we keep saying it, we'll keep saying it over and over. We can't be complacent, and we do need to be prepared if new cases of COVID-19 were to emerge in our community. If that was to happen tomorrow, based on the number of poster scans we're seeing, not enough New Zealanders would be able to remember their movements for us to efficiently trace who has been exposed to the virus and isolate them to stamp out its spread. We can all play a role in doing something about that. So my message to all New Zealanders, please step up your efforts, scan wherever you go, and keep a record of your movements. If you're a business or a place where people go and you've not yet downloaded COVID-19 QR code, please do so. Please make sure it is put in an accessible place where everybody can access it, including those with disabilities and in wheelchairs. If the virus was to re-emerge within our communities, we cannot afford there to be any delay, and we need people to be able to recall where they have been so that tracing can happen as quickly as possible. Happy to take your questions. Colette.
Can you please confirm reports that the government is going to insist on the New Zealand COVID Tracer app to be used by hospitality outlets as a condition, one of the conditions for the borders to open?
No, we haven't had that discussion yet. Obviously, we want everybody to be using it. Whatever we do around compulsion and so on, we'll make announcements on that in due course. But at the moment, we want everybody to be using it.
Disappointing how few people have downloaded the app and are using it?
Look, I think when you look at when we released the app, we'd already kind of started to regain our freedom at that point. And so I think there is a degree of complacency there. You know, life is back to normal for the vast bulk of New Zealanders. And so this is not necessarily front of mind for them. It's certainly front of mind for us here, though, because the risk has not gone away. If you look around the rest of the world, the risk is right there and it's growing every day. And the Prime Minister went through those statistics this morning that would really bring that front of mind for people. So my message is, we're not blaming anybody for this, but now's the time to be vigilant. Download the app, sign up, use it.
Seems that maybe this app should have been brought out sooner then, given when everyone was a bit more vigilant about these things?
Look, I think everyone was working as fast as they could at the time, obviously, to get that app up and running. We have now got the app up and running. We're making improvements to it as we go along. I think it's getting better by the week as new updates are added to it.
You've been trying to drive home this message for about sort of a week now, and yet there's still roughly about 10,000 poster scans a day, which is by no means enough. Can you outline specifically what you are going to be doing to encourage uptake? Are you going to be spending more money on media? Are you going to be taking sort of portable printers around to businesses who don't have QR codes? Like, specifically, how are you going to encourage this?
So the All of Government Group are putting together a range of advice for us on how we can improve the uptake of both the posters and also getting people to use the posters. I'm not in a position to make announcements on that today. Obviously, I'll keep reiterating the messages every available opportunity that I get, and be encouraging all of my parliamentary colleagues to do so as well. But yes, there will almost certainly be additional promotional activity around this very soon.
This app doomed. Would you agree with him?
No, I don't. I think it's getting better all of the time. I think the feedback that I've had from a lot of people who are using it is that the ability to manually add in contacts where you can't scan a QR code, or where you get home and you realise, I forgot to scan in, the ability to manually add that information in will actually make it much more usable for people, and it'll get them into the habit of doing it more regularly.
Are you confident that if we were in a situation of needing local or regional lockdowns, that we'd be able to manage that effectively?
Well, a local or regional lockdown would be very much an all-of-government effort, and that would clearly involve the police and maybe even the Defence Force. So I think from a health perspective, and from the ways we have started working together, or been working together right through this, including in managed isolation and quarantine, we have really well developed mechanisms now for working on these issues across government. So I'm confident that the organisations and agencies that would need to be involved in, first of all, providing advice around a lockdown, but secondly, enabling it to happen. Yes, that would be good. But I think, again, reiterating the importance of testing and contact tracing, those are the absolute pillars of us even avoiding a local or regional lockdown, and hence the importance of people being able to provide us with good contact information and also have a record of where they've been.
In a situation where we needed, say, neighbourhood-wide testing, would we have the capacity to do that quickly?
Yes, we would have that capacity, and that's one of the reasons, first of all, that we've asked DHBs to maintain the CBACs and the staff who are doing that testing daily in quite high volumes. And secondly, we know our laboratories have got good capacity, between 12 and 13,000 tests per day. Remember, our maximum figure we've done so far is just over 10,000 per day, but we could surge that up further. We've got good supplies, over 250,000 tests worth of supplies onshore, so we're in a good position should we need to do widespread testing.
Minister, on the all of government advice, when are you expecting that back?
Very soon. Yeah, look,
What does very soon mean? Obviously, you said not enough Kiwis are scanning. We wouldn't be able, if tomorrow there was community transmission. So what does that mean?
look, within the next week or two, I should be able to say more on that. Obviously, I need to, potentially, if they want to spend more money, there'll need to be some, conversations on funding that as well. So, but we're not dilly-dallying about this. We want to get that information out as quickly as we can.
The app has been out for 2 months now. A number of poster scans daily has flatlined. New registrations of users and businesses have flatlined. The Prime Minister just said earlier today that not enough people are using the app. Why don't you just this afternoon write a regulation that says, as Dr. Bloomfield argued for prior to moving to level 1, that businesses must print out a QR code and put it on their window? Maybe people aren't required to use it, but at least that has to be there for every business. Yeah,
look, I wouldn't rule that out. Obviously, we're going to be considering a range of different options. I haven't had that advice yet, but we'll be considering all of the options that we need to get the posters and the app much more widely used.
The delay in releasing the app, it was originally supposed to be out on April 20, it came out on May 20, a week after we moved into level 2. And in the meantime, all these private sector apps came out. Did that harm the uptake of the app? I mean, the cafe across the street has 2 different QR codes, neither of them are for NZ COVID Tracer. So
yeah, look, I think that wasn't helpful. Obviously, people were working as fast as they could in the circumstances. But yeah, if we'd been able to get it out earlier, that would have been helpful. Bearing in mind that a lot of those alternative systems that people put in place immediately have sort of fallen into disuse, if you like. The COVID Tracer app that we have released certainly hasn't. It's being updated. That information is being stored in a usable format for contact tracing, whereas some of those other systems would require much more manual work in order for them to be able to use. So my message to all those businesses, if you're displaying one of those other QR codes, feel free to continue to do so, but please make sure you have downloaded and you are displaying the official COVID Tracer app QR code.
What will it do to you? What would it take for you to make it compulsory? I mean, where would you get to go, okay, right, this isn't working, we've got to make it compulsory? Is there a certain number or a threshold?
Look, we haven't gone through all of that yet. Like I said, I've asked for a whole lot of additional advice on that, and I will make further announcements on that in due course. But
Minister,
I don't want to preempt that.
Perhaps I could just make a comment too. Just to reiterate the point is, you'll have heard me for many months, the app is an adjunct to the core contact tracing capability and capacity we have greatly upscaled in our public health units and the national capacity. So what it does is it provides helpful information for people to remind them of where they have been. But our public health units and our contact tracing centre nationally are also very good and have been achieving that within over 80% within 48 hours contacting those any close contacts. So the app is important, and from my personal use of it, I found it interesting a couple of days ago to go back through and look at my history and think, gosh, I wouldn't have remembered I had been there on that day. So I think it's very useful for people, and we just need to normalise it. This is going to be with us for a while. Let's just get used to using it.
You've often spoken about how impressed you were with Kiwis and their compliance at level 4 in lockdown. Have you been disappointed about that lack of uptake from Kiwis about the app?
Oh, not at all disappointed. I think, the reality is life feels like it's back to normal, as the Minister said. And so, in a way, it's not surprising. However, what we also need to do, and I think many people have looked at Victoria, and it's a real wake-up call. So we need to make sure we are in the best possible position, and there are things that we can and should all still be doing, including those key public health messages and just getting used to and normalising the use of the app.
So if there was community transmission tomorrow, Dr Bloomfield, are you confident in our contact tracing abilities despite people not taking up the app?
I am confident because of that additional capacity we have built in the public health units, That was the very first recommendation in Dr Verrill's report, as well as our national contact tracing solution and capability and capacity here nationally. And yesterday I got walked through that, the IT system, and how that works and how it links all the public health units, with Auckland Regional Public Health Service coming on board before the end of the month. They've got visibility of all the cases and contacts. It's a very, very good solution. So in fact, that's been a real success story in terms of upping our game around our national contact tracing capability and capacity.
Last couple of questions, yeah.
Are you doing any sort of dry runs of it, of just ensuring that it is continuously up to speed?
I think that's what I was mentioning before. Yes, we are looking at, and trialling it in a few areas, much more rigorous, demonstrations, prototype, dummy runs, if you like, to actually make sure that everything works according to plan.
And so just on the case definition, so was that adjusted because that the previous case definition was so strict that testing numbers got dropped so low that it was unacceptable?
Yeah, so the case definition was still broad actually, but it was, once we'd categorised the high index of suspicion people, and those people all get tested, what primary care was looking for was certainty around, some clear advice and certainty around two things. First of all, who are the people in the lower index of suspicion that they should be testing, because it would be too many given this time of year to test everybody. So we've given that clarity. And secondly, they wanted confirmation that they would be paid for swabbing anybody regardless of what category they're in. So that's the clarification we provided yesterday, with input from the College of GPs, and as you will have seen, it's been well received.
Right.
Would you expect, sorry, just one follow-up. So would you expect that now that that's sort of been broadening, better defined, that testing numbers would go back up again to about the 4,000 mark that you had expected?
That's what we're expecting, and that's what we're aiming for. And furthermore, what we will be doing is every week pulling out a breakdown of that community testing to ensure that there is geographical and ethnic spread of that testing, and if there are adjustments to be made, we will be providing that advice to the district health boards so that they can the GPs in different regions can make sure they're doing more swabs if necessary.
Okay, over the back.
On the testing criteria, so this new criteria, how's it going to increase the testing rate? Is it going to increase the testing rate? And are there any other initiatives, I guess, in the works or being considered to boost the number of tests being done?
So the new advice yesterday was very much about those people with symptoms in the community. And as you will know, this time of year there are a lot of people with respiratory symptoms. It's quite a big group. It includes older people, people with pre-existing conditions, and others who might be at risk of complications should they get COVID-19. Our expectation is that we'll add in several thousand people per day who will be now swabbed, and we will be watching, and I'd expect those numbers to grow quite quickly.
Wanting the testing numbers to increase, is that good enough? Like that extra couple of thousand that you're expecting to see?
Yes, look, and as I've indicated last week, there's also work underway to provide us with more granular information about who's being tested on a regular basis as well, in terms of border personnel and so on. So we do want to focus on those who are more likely to show up a positive result, because that's where the testing can be at its most useful. Last question.
A wee bit of an update on the Prime Minister talked a while back about the potential to be testing people before they get on a plane to come to New Zealand. There was work being done on that. If you had an update on that, and also an update on the situation for people coming into New Zealand to co-pay for their isolation.
So Dr Woods will be the one to make further announcements around any changes to co-payments or charging for managed isolation and so on. As I indicated earlier in the week, the Cabinet's not made any decisions on that, and any decisions around that will of course go to Cabinet before they are announced. With regard to testing, obviously I'll defer to the Director General's expertise on this, but one of the advantages of our testing regime at the moment is that we test people once we have got them into a point where they are unlikely to be exposed to the virus if they hadn't already been. Whereas if you test someone before they arrive here, they can come into contact with any number of other people on the way here. So, but I'll defer to the
I don't think I've anything to add, Minister. I think you've summarised it well.
Yeah.
Do you know when your incoming Health Minister briefing will be made public?
Look, I didn't get a detailed briefing in the way that you get a briefing to the incoming minister. I did get some briefing materials that were largely a compilation of existing information that was available. I understand my office is going to be releasing those. You may be aware, not that anyone seems to have noticed, in the 2.5 years that I've been Minister of Education, I've proactively been releasing all of the briefing materials that I get. They're released at the end of each month for the month prior, and I intend to adopt that process in health as well.
Just going back to the testing criteria, is it enough to ask GPs to use their clinical judgment when considering whether to test someone who is neither part of the at-risk group or doesn't meet the higher index of suspicion criteria? Should the guidelines be more specific in that?
I'll defer to the DG.
Thank you. Yes, I think that's imperative, and that's been part of our advice right from the start. So we're saying test all these people who fit within these groups, and of course anyone else who in your clinical judgment you believe should be tested. So that's always been an important part of the case definition, and it continues to be.
You've spoken in the past about the gold standard for testing, and a few times you've said we've met it. Today the Minister more or less said we hadn't met it. Have the parameters moved there? Or what do you, I mean?
I don't think I said that we hadn't met it. I said that in order to have gold standard, we would want to have, for contact tracing, we would want to have everybody doing their bit, which is making sure that they're keeping good records to enable contact tracing to take place.
Yes, so the gold standard reference was to the contact tracing system rather than the testing per se. So I think, again, just to reiterate, at the moment we are in a very fortunate position where it's clear we do not have community-based spread of or infection from COVID-19. So our testing is, as it should be, focused around the border. Anyone coming across the border, and now the workforce is working in managed isolation and quarantine and at the border, both maritime and air. And we are maintaining and wanting to maintain good levels of community-based testing just as part of our ongoing testing surveillance.
All right, you can have the very last question. We're back tomorrow, so there'll be more time.
Could you please clarify what the funding is for the GPs? Do they get reimbursed the entire co-payment of the cost, or is it specifically the supplies, or how does that work?
They receive a fee, and it's a fee that's been agreed with them, which covers the cost of the visit plus the time it takes to do the swab, which is additional time. The PPE is provided nationally by us, and they receive the swabs too from the laboratories, so that's covered as part of the test too.
So there's no barrier for GPs to, cost barrier?
That's right, and I spoke yesterday with Dr Kate Baddock, who's the chair of the NZMA, and she was very happy with the updated advice and that confirmation about the payment for the swabbing.
All right, we'll see you all tomorrow. Thank you.